47 million people are medically uninsured in America today, and the number is growing. In 2006, it was estimated that 3 working-age North Carolinians died each day simply because they lacked health insurance. The number of medically uninsured in Wake County alone is 155,000 people. Uninsured adults are 6 times more likely to delay medical care than people with insurance. In addition to this bleak picture of health care, further barriers to medical access exist for members of immigrant communities as well as Muslim women because of culturally insensitive health care services. In order to address these disparities, in 2005, a group of physicians, medical students, and volunteers began to lay the foundations for a free medical clinic that would serve the uninsured and economically disadvantaged in Wake and Durham counties. The Mariam Clinic opened its doors to serve the community in October 2007.
There are the people in our communities, especially the women. We are breaking the taboos who do not have access to preventive health care. Simple as like mammography preventing cancer, diagnosing cancer at early stage, or having pap smear diagnosing carcinoma of cervix at earlier stage. These women have not gone to anybody else, but by providing them these opportunity, they have come forward. I think that is an enormous strength in this clinic.
Just a few years ago, when this idea of serving the poor and the needy in the field of health came about, then we started looking for a place. Unfortunately, we even went to some small rooms and shutters, whatever shape or form the place would be. We wanted to establish this Mariam Clinic, but knowing the regulations of healthcare, we just could not start anywhere until a doctor came in and volunteered his place to be used on Sundays, and it is a milestone for someone who is on the streets to get a place to work with.
The effort and put by these young children, boys or girls, to support the clinic on volunteer basis, weekend and weekend out, is amazing. It really heartens you and makes you feel as if any time you are giving to the clinic is worthwhile. And the smile on the volunteer's face makes you feel so good that you want to continue working in a field that seems to be a bottomless, requiring all your energies, all your times that you could be spending somewhere else. And this is the best thing that I got out of it.
The most rewarding experiences come from the personal interactions with individuals. As a physician, when I see patients in the clinic who tell me, I ran out of my medications for diabetes or for high blood pressure 6 months ago. I did not know where to go. The doctor had written me for an expensive prescription. It cost $60 a month. I couldn't afford it. I had to pay the rent. I had to feed my children. And these patients that come in with completely uncontrolled high blood pressure or diabetes, we're able to provide them affordable medications, start them on a regimen, a very simple regimen. And within 2 months, they are back on track. They can be as healthy as anyone without these conditions.